Yeah. Sheesh. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. Watch us how we move like this. Watch us how we move. Oh, yeah. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. celebrate. Yeah. Okay. We gon' celebrate together forever. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. Okay. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. We gon' celebrate. Yeah. Okay. We gon' celebrate together forever. Okay. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. Yeah. We can go and move like this. We can go and move like this. Watch us go and move like this. Okay. Together. Yeah. Oh, yeah. Da 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 da. Yeah. Sheesh. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this. like this. Oh, yeah. We gon' move like this, like this. Like this. Yeah, we gon' move like this, like this. Oh, yeah.
Hello, can you hear me? Good evening, Prof.
Okay, welcome. Hi, Dr. Uche. I wanted to see you move, but I couldn't see you move. So wanted to see the African coming out. So this is great. I think we are back on. So I want to start by just saying good evening, everyone, and welcome to NCCP Thursdays Live. I am Professor Fulakemi Odedina, and I'm honored to serve Nigeria as the chair of the National Cancer Control Plan Technical Working Group. On behalf of the Nigeria National Cancer Control Plan Technical Working Group, thank you for joining us for this important conversation. And I am going to hand it over to Dr. Uche to introduce himself.
Thank you so much, Capacity Dynamic Chair. Good evening, everyone. My name is Dr. Uche Emmanuel Nwoku. I am the National Coordinator, National Cancer Control Program, Freedoms of Health, and the Secretary of the NCCP Technical Working Group. I'm supporting my Madam Chair, who has demonstrated an uncommon capacity to lead this Technical Working Group. Thank you so much, Prof, and thank you everyone for being part of this.
Thank you, Dr. Uche. We call Dr. Uche the 24/7 doctor because he's always on call. But tonight is a very special night for us. We will be discussing a topic that is often overlooked but has a tremendous impact on cancer outcomes, which is the social determinants of health. Just as an introduction, cancer care is not only about chemotherapy, surgery, radiation therapy, or medicine. Many patients struggle with transportation, food insecurity, financial hardship, accommodation challenges, and other barriers that affect their ability to access care and complete treatment. This is one of the reasons that the NCCP Social Determinants of Health Initiative was developed as a priority initiative. We have an outstanding group of speakers and panelists with us tonight, and we look forward to an engaging section. And now I'm going to pass it on to my TWG partner, the 24/7 doctor on call, Dr. Uche, to introduce the panelists that we have today.
Thank you so much, my chair. The panelists we have for today are Pharmacist Fumi Oduniyi, who is actually the chair of the SDOH Implementation Committee. And then we also have Dr. Emanuela Nwachukwu. Emanuela is the geopolitical liaison for the FCT. And then we have Dr. Catherine Oladoyinbo, who is the chair of Community Engagement Subcommittee. And I have Mr. Dennis Olise, who is the co-chair of the Communication Subcommittee of TWG. Then Dr. Hassan Dogo, who is the co-chair of the Northeast Geopolitical Zone. So we have them as panelists this evening. They will throw more light on what the SDOH is going to be doing. Thank you.
Great. So thank you so much for that great introduction, Dr. Uche. We have a really jam-packed outline today. We're going to start with a brief presentation by myself, Dr. Uche, and pharmacist Oduniyi. And so I want to really go in by beginning and focusing on understanding exactly what we mean when we talk about social determinants of health and why this matters so much. Thank you so much. And really to go into this really quickly, this is things that a lot of us might be aware of, but there are things that we may not be aware of. So social determinants of health are the everyday conditions in which people are born, live, learn, work, worship, and age that affect their health and well-being. So whatever environment that we are in, it could actually contribute to our health. For cancer patients, these are often the challenges that happen outside the hospital, but have a major impact on whether they can get care and survive cancer. As we say within the NCCP Technical Working Group, cancer care is more than the treatment. So what are the examples of social determinants of health barriers? Transportation to treatment centers, food and nutrition during treatment, financial hardship and loss of income, distance from cancer care facilities, health literacy and awareness, family and caregiver support. These are just a few of the examples that people experience. I want to actually give a personal example that was shared with me on one of our social medias, in which a clinician in Nigeria actually reached out to me and talked about a really social determinants of health barrier that was had by one patient at a clinical site who had to stay and sleep on a bench at the hospital to be able to continuously have their treatment due to the distance that they have. So these are some of the things that really shows that cancer does not affect everyone equally, because people do not start from the same place. So why cancer care is more than treatment for us, and why do we take it so personally within the NCCP Technical Working Group? This is because behind every cancer statistic is a human story. Every day in Nigeria, approximately 350 people are diagnosed with cancer. More than 222 people die from cancer. One Nigerian dies from cancer approximately every 6-7 minutes. What does that mean? Within the few minutes that Dr. Uche and I have come on, we most probably have one or more Nigerians that has died from cancer. But many of these outcomes are not due to cancer alone. They are due to the challenges that are often faced because there's no transportation to treatment, there's no food during treatment, there's no money to lodge or travel to the hospital or the clinic. There are missed appointments because of all these issues. There is loss of employment and income. Our family and caregivers experience a huge burden because of cancer. So the best cancer treatment in the world cannot help if patients cannot access it. I know the federal government of Nigeria is doing a lot to be able to contribute to cancer treatment, but we have to do a whole lot more and come together as a global village to be able to address social determinants of health. So how social barriers affect cancer outcomes? So many, and these are just examples, and I'm sure some of the people who are watching us today really understand these examples more than everything else. It could lead to delayed diagnosis, delayed treatments, missed appointments, treatment interruptions, poor nutrition, increase in stress and anxiety, worse treatment outcomes, higher risk of death, and the result is more suffering, lower survival, greater health inequalities. And this is what we know. Many cancer disparities in Nigeria, they are driven by late detection, diagnostic delays, limited treatment access, workforce shortages, social determinants of health barriers. So the health outcomes are shaped not only by medical care, but they also are shaped by the conditions where we work and where we live and our environments. So I just want to talk about what our goals are, and I'm going to pass it on to Dr. Uche to really talk more about the realistic experiences within the Nigeria context. So why is the TWG, the Technical Working Group of the NCCP, investing in social determinants of health? In fact, I am very proud to say that this is the #1 initiative that we came up with for the Technical Working Group. This is because our goal and our mission is that no patient should be left behind. Our goals are to improve access to treatment, support vulnerable patients and families, reduce inequities in cancer care, improve treatment completion, improve quality of life, and support cancer-free Nigeria 2030. And we are offering quite a number of support through this initiative. This is our commitment to you. We believe that where you live, what you earn, or the challenges you face should not determine whether you survive cancer or not. And that is a commitment to you. Now, I want to bring on Dr. Uche to talk more about the context of Nigeria for social determinants of health.
Thank you so much, Madam Chair. You couldn't have done it any better. In Nigeria, I have been around for a while. I've been involved in implementing several government interventions, including the Cancer Access Partnership Program, the Cancer Health Fund, and of course, also improving infrastructure in our tertiary health institutions. And with all those interventions from government, why do we still have late diagnosis? Why do we still have very poor outcomes of care? Why do we still have so many people dying of cancers in Nigeria, despite providing free treatment in some cases and providing access to relatively cheaper, innovative medicines in Nigeria? I have personally been involved in leading these initiatives for the past 5 to 10 years. And the question actually came very clear when the TWG came on board and Madam Chair introduced the SDOH. And of course, we found out that this actually is the major reason many people do not access the various laudable government initiatives. Because even though we have relatively cheaper medicines in our tertiary health institutions, these tertiary health institutions are located in capital cities of the various states. And the terrain of Nigeria is such a way that there are so many people who live more than 6 hours from their own state capitals. That means if they have to travel from the various communities to the state capitals,
I believe we might have a little bit of technical difficulty with Dr. Uche, and while we fix that technical difficulty, it's given a really powerful experiences that we have in Nigeria. I'm going to invite pharmacist Oduniyi to come up and talk a little bit more about our Social Determinants of Health initiative. Pharmacist Oduniyi, are you on? And then we bring Dr. Uche back. Pharmacist Oduniyi, please. Okay. Thank you. I've just been informed that Pharmacist Oduniyi is not on yet. So While we are waiting for Dr. Uche to join us, I would like to bring on our panelists. So could we have Mr. Ulisse, Dr. Emanuela, Dr. Dogo, come on, please, and Dr. Oladoyinbo. Thank you so much. You know, one of the things that we need to recognize with being Nigerian so diverse is the fact that we speak multiple languages. So I'm going to put you all to task today, and I want to start with Dr. Well, I want to start with Dr. Oladoyinbo. Dr. Oladoyinbo, I want you to speak in Yoruba and just give us like about a 1 minute conversation, 1 to 2 minutes, about what social determinants of health are and why this is so important. Yoruba, no English, no broken, no nothing. I want to hear it in Yoruba.
Thank you very much, Prof.
You have said
I started already. Gbogbo àwọn ènìyàn wa tí wọ́n ń wò wá ní ìrọ̀lẹ́ yìí, ohun tí à ń gbìyànjú àti sọ fún wa ni wípé à ń sọ̀rọ̀ nípa àwọn ohun tó máa ń dènà ìtọ́jú àwọn tó bá ní àrùn jẹjẹrẹ, àwọn oríṣiríṣi ìdènà tí wọ́n máa ń rí tó máa ń kọjú sí wọn, bíi pé lórí ọ̀rọ̀ oúnjẹ àbí owó mọ́tò láti lọ sí ilé ìwòsàn, àbí nígbà míì gan àti jẹun, àbí àti sanwó lé nígbà míì. À ń sọ̀rọ̀ nípa owó ìtọ́jú àìsàn yìí o, ṣùgbọ́n owó àti jẹun àbí owó àti wọ mọ́tò débi tí wọ́n bá ń lọ. Àwọn pòfẹ́sọ̀ wa sọ fún wa nípa obìnrin kan tí ó wá fún ìtọ́jú tí wọ́n rí ìfà lọ sí hospital ibòmíì tó jìnnà síbi tó ń gbé. Nígbà tó débẹ̀, owó mọ́tò àti máa lọ máa padà ni kò ní. Ó wá dẹni tó ń sùn sí orí bench nínú hospital fún odindi ọ̀sẹ̀ bíi mélòó kan nítorí pé kó lè rí ìtọ́jú yìí kó lè rí gbà. So gbogbo nǹkan tí à ń gbìyànjú àti sọ fún wa ni wípé the social determinant of health tí à ń sọ fún wa ni wípé owó yìí ni nǹkan tí à ń ṣe ni wípé a fẹ́ wo bí a ṣe lè ran àwọn èèyàn wa lọ́wọ́ láti lè rí àwọn ọ̀nà láti dojúkọ, láti lè reduce àwọn ìdènà yìí tí wọ́n máa ń rí nínú ìtọ́jú àrùn jẹjẹrẹ.
Oh my goodness. Okay. I am impressed. I'm super impressed, Dr. Oladoyinbo. So we're going to pass it on to Dr. Uche to finish his conversation and examples. And I'm going to put Dr. Uche to task as well. Once you finish your examples, I want you to talk in Igbo language and explain in 1 to 2 minutes what social determinants of health is. I think you're still muted, Dr. Uche.
Yeah, thank you, Prof. Sorry, the performance of my network. Yeah, I was trying to give examples of why so many interventions that were provided by government were not being properly assessed by cancer patients in Nigeria because of the terrain. And of course, before now, cancer care was not also part of national health insurance coverage. So that also adds a lot of burden on the patients and the families. And if people have to travel from their locations, that will take them more than 24 hours to be able to access care and return, that means they will require a caregiver. So this also adds to the burden of care. So several people also live below poverty line in Nigeria, and so that also is a problem. So these together add to the burden of cancer treatment or makes cancer care in Nigeria more catastrophic than any other part of the world. So, and that is why this has come handy. This is going to really improve uptake of the various interventions by government and by other people who are going to be supporting our cancer patients. Thank you so much. And if I may translate some of what I've said in Igbo language, social determinant of health bụ ụmụ ihe na-emegasị ka ndị na-arịa ọrịa nje a na-akpọ kansa ghara inwe ike ịga ụlọ ọgwụ nata ọgwụgwọ site na mgbe a gwara ha na ha na-arịa ọrịa kansa ruo mgbe ha ga-ebido nata ọgwụgwọ maọbụ otu ọgwụgwọ ọzọ ha nwere ike nata. Ụfọdụ nwere ego ha ga-eri nri, ụfọdụ nwere ego ha ga-agba ụgbọala eje, ụfọdụ nwere ego ha ga-eji kwụọ ụgwọ ụlọ ọgwụgwọ ebe ha ga-alahụ nwee ike nata ọgwụ ha. Ume ha bụ ihe na-emegasị ka onye anwa ghara inwe ike gaa n'ebe ọ na-anata ọgwụgwọ. Ọtụtụ n'ime ndị na-arịa ọrịa kansa bụ ndị Naijiria bụ ndị bitere aka n'ebe ụlọ ọgwụ nwere ike inye ha ọgwụgwọ a dị. Ya mere ha nwere ike tupu ha ike oge nweta ofu onye n'ime ezinụlọ ha na ha nwere ike iso gaa. Ụmụ ihe bụ ihe ga-emekwasị ka ego ha ga-eji wee gaa ama ụzụ ịnata ọgwụgwọ anwa. So ya mere na ya na-akpọ Social Determinants of Health bụ ụmụ ihe a ga-eji nye ha ọgwụgwọ ka a nara ọgwụgwọ site n'iriju afọ, site n'ịkwụ ụgwọ ụlọ maọbụ inweta ụgbọala ha ga-eji wee jee. Thank you so much.
Thank you so much, Dr. Uche. I understood everything. I'm going to call on Dr. Dogo. Dr. Dogo is actually already ready. Look at how he's dressed. He's ready to speak in Hausa to us. So, Dr. Dogo, can you summarize what has been said in 2 minutes in Hausa for us, please?
Yes, thank you. Yes, thank you. Thank you, Ma. Shi wannan social determinants of health a Hausance ana nufin abinda kullum muna yi muna tare da shi kuma baya daga cikin ɓangaren rashin lafiya, amma shi yake nuna ya lafiyar mutum take. Na farko ana maganar tattalin arziki. Idan tattalin arzikinka bai da kyau, to baya da za a yi ka samu lafiya mai kyau. To shi yasa yawanci zaka ga mutum sai yana da ma kuɗin da zai je asibiti kafin ma ya samu ya ga likita. To na biyu kuma ana magana ilimi. Ba ka da ilimi, baka san ilimin abin da ke faruwa ba. To ba zai yi ka ce bari in je wannan likitar ba. Ba za ka iya zuwa ka ce bari in je nemi lafiya ga abin da yake damuna gashi ba. To na uku kuma zuwa asibiti ma wani sa'in akwai abubuwan da za su hana ka ga likita, ko kana tsoron zuwa ko kuma baka gane abubuwan suke ba.
Thank you so much, Dr. Dogo. Have you wrapped up?
Yes, so wayannan su ne abubuwan da muka ga su suna da akan rashin lafiyar mutum sosai.
Thank you so much. You can see the technical working group is ready for you. Whatever language you want to speak, we can speak it. Now I'm going to challenge Mr. Olise. He's actually going to talk in our own common language. He's going to spend about 1 to 2 minutes using Pidgin language to explain about social determinants of health. And then Dr. Manuel, get ready for French.
My people, good evening. What do we bring today now? What do we call social determinant of health? That's the new initiative where the people where they call themselves NCCP Technical Working Group. Now they just bring for us, especially for cancer patients. We know say not only medicine going to for those where they get cancer disease. We know say not be only medicine, now be the issue. We dey encounter transport. If we want go hospital, many of us not get transport to take go. If our house far from hospital, if we want go with 1 or 2 more people, we need to look for where accommodation where we go stay. We not get all those things, and also many other things. We still face so many conditions. That is why they can't bring this initiative where they call social determinant of health. They say they will bring small shishiri something to take support us as we go for this treatment, either for transportation or for hostel accommodation near the hospital, or even for food and nutrition. Those are little things where this initiative they all about, to just help us make we get small money to take they do those things. That is why they call them social determinant of health, just to help ameliorate small things where we fit take care of. Thank you.
Oh my goodness. Okay, so we're going to start by giving the TWG a grade. So for all our viewers, from 0 to 100, what do you think of us making sure that we translate everything in Igbo, in Hausa, in Yoruba, and Pidgin? It's left to them. If they don't score well, that's them. If they score very well, it's all of us. So give us some grade. Let us know how we're doing. But thank you so much for being inclusive, because this is very important. Language barriers should never stop anybody from listening to what we are doing and understanding what we are doing. We are trying to eliminate all the barriers. So one of the strengths of the NCCP is that we bring together, as you can see, clinicians, community leaders, advocates, survivors, researchers, policy leaders. We all bring us together, and now we would like to hear different perspectives on why addressing social determinants is so important and how we can work on it. So this will be me and Dr. Uche moderating this section. So we will start the question with Dr. Oladoyinbo. I believe, Dr. Uche, you have a question for Dr. Oladoyinbo.
Yes, thank you. Dr. Katrina, from a community engagement perspective, how can communities, faith-based organizations, and local leaders help to address social barriers faced by cancer patients?
Okay. Thank you very much, Dr. Uche. And thank God I don't have to speak Yoruba again. So I can answer this in English. Okay, so the community has a significant role to play in addressing the barriers faced by cancer patients. The communities, this cancer patient lives within the community. And so the community, aside what the clinicians, the hospitals are doing, the community has a very critical role to play in removing some of these social barriers that cancer patients face. The first one has to do with demystifying a lot of issues around cancer. You know, most of the time, there are a lot of myths and stigma that surrounds cancer. For example, a lot of people believe that cancer is a spiritual, if somebody has cancer, it's a spiritual attack, or sometimes they even believe that maybe you have done something bad. That is why you have been afflicted with the disease. Sometimes people even believe that maybe, it's contagious. People not want to associate with anybody that has cancer. And so one of the things that the communities, and when I said the community includes everybody, starting from our faith-based organizations, our pastors, imams, associations, market groups, youth groups, all CDAs. Think of all levels of people in the community. They all have a role to play. So the first thing is, how do we, demystify some of these myths and stigma that surrounds cancer? So some of the things that the communities can do is to maybe create a lot of awareness around the issue of cancer, especially bringing people, who have been affected by the disease to talk to people in the community. And we've done that in several places, and it has really worked for us. So one of the ways by which the faith-based organizations can help in addressing the problem of myths and stigma that surrounds cancer is by promoting a lot of awareness around the issue of cancer. Another thing that the communities can also do is to provide a lot of psychosocial support for people that have cancer, and even the caregivers that are taking care of the people that have cancers. And most of these people need a lot of support. There's a lot of financial toxicity when it comes to cancer treatment, and the people who are also taking care of them, the caregivers, also it's not only the cancer patient that are also suffering, their caregivers also suffer. So both the caregivers and the cancer patients need a lot of support. So our communities, starting from our faith-based organizations, can provide a lot of psychosocial support. Some of our pastors and imams need to be trained on doing counseling for some of these cancer patients and even their caregivers, supporting them. We can create support groups. I heard of a particular church in Lagos where they do once in 4 months, where they do My Breast and Cervix Sunday, where people come, and then they on that particular Sunday is just addressing the issues of breast cancer and cervical cancer. So those are some of the initiatives that we can bring in. So many ideas that we can bring into our from our community, in helping some of these cancer patients to overcome some of those social barriers. We can also provide support. It's not only support or creating awareness. We can provide other support like transport and food, and so it's not only NCCP, the Social Determinants of Health fund that we are raising, that we can use to support, but we are also saying that in our different communities, we can begin to raise, special fund support, even if it is just transport, for some of these cancer patients when they are going to the hospital, and it will enable a lot of people who have been hiding and don't want to come out to talk about the disease. It will give them the courage to be able to come out and talk about their disease. So the community has a very critical and important role to play. Thank you.
You can see how passionate Dr. Oladoyibo is about getting the community, roused up and engaged. I want to go on. Thank you so much for that response. You are essentially saying it takes a whole village, it takes the town, it takes the whole country, it takes a global village for us to be able to do what we do. I want to go on next and ask, the two clinicians on a panel about really focusing on specific things on social determinants of health. I want to start with Dr. Emanuela Nwachukwu, who was yesterday when we had a meeting, was so passionate about her patient. She's like, we are going to do this, and we're going to have to take care of that. So I know that you're very passionate about this, Dr. Manuela. So let me go to you first. As a clinician, how have you seen social and economic challenges after cancer outcomes affect cancer outcomes among your patients?
Okay. Thank you, Madam Chair, and good evening to everyone. So I'm going to paint a scenario, okay? I'm going to talk about, when we keep saying people come with late diagnosis, they don't present early, we keep seeing them in advanced stages. I want to paint the 58-year-old woman who, comes into the clinic with a very advanced tumor. And when I ask to say, why didn't you come early? How long have you had this? And she says it's been there for 2 years. So you inquire more, you want to find out, like, why didn't you come to the hospital early? Why are you coming this late? I had no transportation, to travel from the village where I am to come to the city or to, seek further care. I saw, maybe a traditional person who said, it must be somebody who is responsible for this. And I got to see the value of just transportation. So little things like transport will make people present to the hospital early. Because if there's any support that can help them, this might just be the reason. Even if we fix, ways to be able to make sure you get your screening free, if you're not able to get to the hospital to do that screening, then you won't be able to screen. So we have it affecting, their delayed diagnosis, then treatment adherence. Sometimes we go out of our way, we look for funds, we have chemotherapy drugs available, and the patient is not able to come in for the treatment because they do not have transportation to reach the hospital. Then I've had one patient come to tell me, "Doctor, I haven't eaten. It's been, so difficult for me and my family at this time." So at the end of the day, you now say, "I want to give you chemo, which is going to, make you feel really weak, and hypoglycemia will come in from you not having food to eat." So these little things come together to contribute towards the challenges that people with cancer will face. That if we're able to surmount this might just be one of the, gaps that we will close, because we keep closing the care gaps, and this is one big gap that this SDOH, will help, because at least patients will have ways to be able to reach the hospital. Even if we do have free screening for them, if we have free treatment for them, they will still be able to come to the hospital, and when they get back home, they have at least food to eat. They have, it will reduce the psychological stress. So sometimes we focus on just the treatment. We come in and say, "Oh, your chemo is every 3 weeks," without realizing, if you're going to travel from Benue to Abuja every 3 weeks, or you're going to travel, from Okene to Abuja every 3 weeks, how much will this cost, and how are you going to cope with this? So we see it every day. We try to counsel them about how important it is for them to adhere to their treatment, but we have to look at the ways that we can improve, through the SDOH. Thank you.
Thank you so much. Your passion comes across so widely. We're going to have Dr. Dogo ask the same questions. And Dr. Dogo is just one of these highly passionate person as well. He was yesterday, he sent an email to me and just saying, "Thank you, thank you, thank you for the TWG taking it on. I'm out there. I'm asking my patients to complete the form to register to receive it, to receive the social determinants of health." So the same questions goes to you, Dr. Dogo. As a clinician, how have you seen social and economic challenges affect cancer outcomes among your patients?
Yes, thank you, Ma. I think the social and economic factors, they have great impact on our people, especially in this part of the country where we have many people in the low socioeconomic class. In fact, we realize that if you can give them transport and a meal, the patients themselves will be asking you, "When is my next appointment?" Because there was a study we did, and we realized that when they come and for their clinic, and then we give them questionnaires to answer, we give them transport money and at least a money that will cover a meal, we realized that their compliance is more. In fact, they will be the ones calling you to say, "Okay, when is my next clinic visit?" So as little as transport can influence compliance in clinic attendance and follow-up. Then another socio-cultural factor that has a significant impact in this environment is influence of the man that controls the household. Usually the man controls everybody in the house. And this goes back to economy because he provides everything. So he is the one to say, "Okay, you are to go to the hospital today, or you are not going until when I have money." So even if they have money to come to the hospital, even if they are sick, especially the females, until when the man has money, before they will be allowed to come to the hospital. Then thirdly, there is a big barrier in our hospital, which I think is a big barrier. Most of our hospitals, when you go in, you will hardly see a place where they will say this is cancer screening center, where somebody can walk in and get his prostate, cervix, or breast to be screened. So I'm looking at having a one-walk screening center in some of our hospitals. so that people will have access to it. Because this is a big barrier. People will come into the hospital and will be asking you, how will I get my prostate screen? I'm not sick. I'm not coming to see a doctor because I'm sick. But I learned that it's good to do a prostate cancer screening. So this is also a big barrier. And now another barrier that is causing a big problem is insecurity, displacement of people, and also the issue of some of our health facilities being destroyed. But I think as little as transport to the patients and maybe a meal while they are in the hospital before they see a doctor will go a long way in addressing issues regarding cancer treatment. Thank you, ma'am. Yeah. So
Thank you
these are
so
some.
much. I think Dr. Uche has the question for Mr. Olise.
Thank you so much. So, Mr. Olise, I have a question for you. As a cancer survivor yourself, what social challenges had the greatest impacts on your cancer care journey? Just to share your experience.
Okay. Good evening once again. Where will I start from? I've had to tell so many stories about my journey, concerning prostate cancer. But I think cancer is not just a medical condition. It has its social and economic challenges. You see that beyond that period of diagnosis, or when you are diagnosed of the disease, you have the major challenge you face is accurate information. First of all, you have the financial burden concerning care, and you also have that fear and stigma. My experience concerning stigma, it was like, it has to do more on the sexual part, because they will say, like this one, enough it do again. Can imagine a young man of 50 something years old, and you have a young wife, and the next thing that you cannot do again. So it was like a stigma. People, when I talk to them about this, and they say, look, in fact, they will be looking at your wife and you somehow, you know. So that's a big social challenge. Um, I've learned in my experience that, as a cancer survivor, you need very strong support system. You need access to very reliable information and financial protection. Let me give you an example of when I was diagnosed, and we practically searched the internet to get reliable information concerning it. I didn't know much about prostate cancer when I was diagnosed. So even while we were in the hospital, I was always asking the doctor, what is this? What is the result of this? This result, how do you translate it in simple language that I can understand? Even when the doctor explained, we will still go back, use a chat GPT, use the internet to kind of cross-check all those facts. And those things really helped us. By the time we were leaving the hospital, in fact, the doctor was saying that he's giving us a honorary degree in medicine, because we had, whatever they say, we always have a confirmation from it. And that's where the website, another thing that NCCP is creating, we have a pool of knowledge where people can go ask questions, and find out why is this so, and even interact with people of like mind. So it's always very important for as a survivor to look at those social challenges, and look at where you can get those um, ameliorations. What I mean by amelioration is how you can get help from those very important because it will help to build trust and help us to be able to be confident in approaching treatment and even beyond. Thank you.
Thank you so much, Mr. Olise. It's always good to hear your voice, and you always say that you represent the reason why we are all here. I will still pass it on to Dr. Uche. Maybe you have a follow-up question for Dr. Dogo and Dr. Emmanuel Nwachukwu.
Yes, Prof. Yes, the clinicians in the room. Maybe we'll start from Dr. Dogo at this time. Why is it important for healthcare providers to consider SDOH as part of comprehensive cancer care?
Okay, thank you, sir. This is very important because without the social determinants of health, it's very difficult to achieve comprehensive cancer care. And this social determinants of health is something that we are always with. We grow up with it, and it's always with us. So without improving the economy of the people, there is no way they can achieve universal health care. In Nigeria, if you look at it, most of the payment for health is out of pocket. And the health insurance coverage is still very low. So there is need to have good social determinants of health so that the health indices of the people will improve. Wow, this is serious. Hello? Yes. So it's very, very important. And especially in cancer care, if you look at when you mention cancer, the whole family is thrown into confusion. The confusion is not only in terms of looking at the disease itself, but everybody knows that caring for cancer is costly. It's very, very expensive. So for you, the patient and the family, the economic burden is much. And the social determinants of health will help in reducing the economic burden, the financial toxicity on the patient and the family as well. Because everybody knows caring for cancer patient is very, very expensive. And apart from that, the social determinants also encompasses community support. So once you have the support of the community as well, the patients do better. They are part and parcel of the community, and they can come out and even say about their diseases. So thank you. And we have seen this during our World Cancer Day, the last World Cancer Day. A lot of cancer survivors came out. We were at the Shehus of Borno's Palace, and they talk about stories that were very, very fantastic. And that will definitely encourage people to come out, and it will also help the government in improving on the social determinants of health. Thank you, sir.
Yeah, Dr. Ella, so what's your perspective on that?
On that, yes. So thank you, Dr. Uche. So for me, the first thing is holistic care. That's what I look at to say, I'm not just prescribing or giving medication, treating the tumor, I'm treating the whole person who's in front of me. So if we include this, then it means I will be addressing all the other challenges that she or she may be facing, that would hinder their ability to come into the hospital, their ability to be able to ensure that they're compliant with their treatment. And, it just gives them this sense of belonging. when they know that, even every single aspect of their life is being, considered when we are doing the treatment. But for me, one thing that will stand out with this is it would reduce the inequities. So you have, high socioeconomic and low socioeconomic patients. Now, the people who would benefit from this, at least it would help them to ensure that, they are able to receive their treatments seamlessly, because all these other factors that will contribute to their missing treatments or not coming for follow-ups, is being sorted. So you would find that this would really close that gap of maybe low to high socioeconomic. So I believe that where you stay, shouldn't really determine, or what you can afford shouldn't determine whether you receive treatment. So this will really close that inequity. Then the other thing is it would improve survival outcome. Now, if they're able to come around, they're able to come for their care, if they're able to get support for feeding, this would help. Looking at, okay, maybe a patient who's done surgery, you need, nutritional benefits. You've taken chemotherapy, you need nutrition from your food. If you're not eating and then you lack all of this, we would start going blood transfusions. It makes the treatment very, very, difficult for these patients. So if we're able to get all of this sorted, it would develop this kind of trust. So the patient knows, oh, they're taking care of me holistically. They're not just looking at, oh, it's the tumor, we want to treat the cancer. We're doing everything to ensure, yes, the medications are available or you have treatment to come for. But we're doing all of this to make sure that the patient feels whole. And to me, it's part of our multidisciplinary management, because this is what we practice. We have social welfare equally with us, when we do our MDTs, because we need them to be able to take care of these social aspects. So it is a very, very, very critical part of, the patient's journey when it comes to management of people with cancer. Thank you.
Thank you very much. I'm going to throw a question to Mr. Olise, and Dr. Oladoyin will start getting ready, because the next question will come to you through Dr. Uche. But Mr. Olise, what message would you share with cancer patients and families who may currently be struggling with barriers beyond the medical aspects of cancer care?
Well, I think the simple message that you are not alone. Diagnosis does not define who you are. It does not define your future. So these challenges are real. The financial pressures will come, transportation difficulties will come, loss of income, all this will come. Uncertainties about where to find help, all this will come. So what you need to do is to ask questions, seek support as early as possible. That as early as possible saved my life. I keep saying it. If I had not taken a very early decision, I think we will not be having this conversation. Connect to survivors group, try and meet friends that understand the situations, and they will be able to help. Take advantage of, like Dr. Oladoyibo talked about, community outreach, community resources. I had an experience of, it was through a common flyer that of a foundation outreach. That is what I used, and I was able to get help from there. Just a simple flyer of a foundation having a free prostate cancer screening. That is what I saw, and that's what I took. That's where I took my decision to go for screening, and the outcome started the journey of where I am now. It is important to say this, very, very important, that no one should have to navigate cancer alone. I think that is why the NCCP TWG is working on, we have to work together to ensure that this burden is reduced. And for majorly stakeholders, it is important that we work on this social determinant of health initiative, so that I hear in America, for instance, there's even a legislation that they are working on. A legislation. I was researching it. They were saying, I don't know, Prof, you are in America. They say Lane Jones Comprehensive Cancer Survivorship Act. I think they are going to the point of having a Cancer Survivorship Act created to ensure that cancer patients and survivors are taken care of. I think we are heading that direction too. I pray we'll get there in Jesus' name. And for survivors, we are a living proof of this, that there's hope for us beyond diagnosis. Our responsibility is to ensure that the hope is available to as many people as possible. And that's why we need to reach out as much as possible to people, talk with them, give them trust, give them hope, and let them trust us, because we have been through that journey, and we will always like to share information on whatever the stage of their disease is. So thank you very much.
Thank you so much. Dr. There you go. So I don't know what you think. What role do you see community education and awareness playing in ensuring that people know about and can access SDOH support services? Did you hear me well?
You're muted, Dr. Lalo.
Okay, sorry. Thank you, Dr. Uche. And just use this the last few days, the experience we have had, to explain question. So some few days ago, about when this SDOH registration came up, we decided to just enter into all our clinics and reach out to as many cancer patients as possible to register for the SDOH. And because I work at a center where we have a registry of cancer survivors and patients, we have a lot of them. So we started calling, and the response I was getting, even this evening, up until around 6 p.m. this evening, the kind of response I was getting shows that the social determinant of health is very critical at this point. Some of those men were telling me that, you mean, an initiative like that is, I said, it's just, you just go and register. You just register. And people are, the numbers of people that have registered within Monday and today, is really overwhelming. So what I'm
Well, I think we just had another attack of social determinants of health with Wi-Fi. But you can hear that Dr. Oladoyinbo is very passionate about this. So I think one of the things that we want to quickly do before we start taking questions from you is to just explain what is the what are we doing? So I'm going to talk about what we are doing. We were hoping that pharmacist Oduniyi was going to be here, who chairs the Social Determinants of Health Initiative. Unfortunately, she wasn't able to join us. But I would explain what it is, and I will let Dr. Uche go over the process that we are going to launch, I believe, on June 17th. So I want to let you know exactly how passionate it is. The NCCP Technical Working Group were charged by the Honorable Minister of Health and Social Welfare and the Permanent Secretary and the leadership of Federal Ministry of Health to turn the National Cancer Control Plan into action. And while we have a very strong implementation plan, which we're going to show through this platform, So for those who are joining us today, if you just tune in, go to YouTube. Every 7 p.m. Nigerian time, there's always going to be something that we are bringing you from the National Cancer Control Plan Technical Working Group that you can learn from every Thursday. But one of the very first things that we said was that our number one initiative must be addressing social determinants of health. So how are we doing this? We are doing this by you being able to register. A lot of you would have seen the flyer. We will show the flyer at the end of our program. And thank you for holding on. I know we always say 1 hour is the time that we are going to use, but we always run into 1 hour 30 minutes. So I hope our panelists will be able to stay on and take questions, because we need to answer the questions from the audience. So our plan is, once you are registered for the social determinants of health, I know that the form, is very comprehensive, but it's very comprehensive because we want to make sure that we are able to support the people that need support. Right now, this program focuses on cancer patients who are on active treatments. And regardless of what you apply for, we are going to provide funding as much as we are able to provide the funding. We have to validate the processes that you do the application. Then we have to look at your application, and then we have to validate with the clinic that you have to make sure that it is well validated. And then once you are validated, you are in the pool that has been approved for social determinants of health, and we begin to disburse as much money as we can. We are praying that the money does not get empty, but our goal is to continue to do this. So I'm going to hand it over to Dr. Uche to talk a little bit about our launch off on Wednesday, June 17th, and describe what exactly are we going to be doing in this disbursement for the first phase. So this is the first phase of the disbursement.
Thank you so much, Chair. So based on the recommendation of the Technical Working Group, the Honorable Minister of State for Health, Dr. Isaac Adekunle has approved and accepted to personally flag off the disbursement of the Social Determinants of Health to registered and verified Nigerians. He has been passionate since he assumed office as the Minister of State for Health, and then cancer being one of his portfolios. He has passionately looked for how to ease the burden of cancer among the sufferers. So that was why he did not hesitate to approve the SDOH and then accepting to personally launch it. We understand that Nigeria now, this is a political period, but he told me he was going to shelve every engagement he has because this is very crucial in the heart of this government. The Federal Ministry of Health is called Federal Health and Social Welfare, and he believes that the welfare of cancer patients is paramount, so he had to shelve every engagement to make sure he does this. So, and on Wednesday, 17th of June, at 1 p.m., he will be live to launch it. So those who are within Abuja may do well to join him in person, and those who are in the diaspora may also join virtually to witness this epoch-making event. So what we're going to do is we have seen the registration done from all over the country, and we commend our physicians who have personally taken efforts to encourage patients to register and verifying these patients. We also commend all the chief medical directors and MDs of various institutions who also have recommended their patients to this. The essence of it all is to ensure that patients no longer struggle to access care being provided by our experts in various fields of oncology across the country. Okay, so what we are trying to ensure is that there are patients who are on active treatment. Okay, so we understand that people may have labored and done their treatment and have survived by the grace of God, but the people who want to support them because the funding is grossly limited. So if we're going to do for every cancer patient, then it will be so ridiculous we won't be able to even do anything for them. So we want to prioritize those who are active treatment. Okay, so those who have registered, we've told over 400 or close to 500 persons have registered, and then a number of people have also been verified. So we're going to put up those who have been verified, launched in Abuja. The Honourable Minister has also approved zonal geopolitical zone launching. So that means wherever we're going to meet you with these forms. We're not just going to do it in Abuja, we're going to meet you in your geopolitical zone with this form. So that means the Honourable Minister will be launching for FCT and North Central on Wednesday, 17 June. And then the Permanent Secretary will be representing the Honourable Minister on the 22nd of June for the Southeast. And then he has directed that we also put up dates for the Northeast, for the Northwest, for the South-South, and the Southwest. So all the entire geopolitical zones will have this form disbursed for patients who are in those regions. Okay, so, and then he has also graciously approved what we recommended. I won't say the amount. So that means he will do that announcement by himself because it's too huge for me to talk about. The Honourable Minister will do that by himself on Wednesday. So what it means is that as many people that have applied, that means there is something for all of you. So that is good news for all cancer patients across the country. There is something for all of you. So the minister has graciously approved that. So on that day during his speech, we'll be able to tell us how each of them are going to receive it. But we're going to make sure that it is done within this period so that those who are being scheduled to go for a treatment can do that as quickly as possible. In other words, transportation, feeding, accommodation will no longer be a barrier to cancer patients in Nigeria receiving their care. Thank you so very much.
Wow, this is great news, and I think it's breaking news from for all of us.
Yes.
So we can't say how much it's going to be, but I just had Dr. Uche promise that most likely as many people that have applied, if you go and apply now, we don't know about that. But as many people that have applied, did you see the smile on Dr. Emmanuel's face? Emmanuel, like fighting yesterday. No, my parents are ready. You can see Dr. Dogo is also pretty much excited about it. So we're going to start taking your questions in about 2 minutes. Pharmacist Odunayi is on. She's the chair of our Social Determinants of Health Initiatives. I should just go on briefly for about 3 minutes, provide an overview of the Social Determinants of Health Initiative. We are so glad to have you here. I think Dr. Uche has told us that we have to keep secret the amount that is going to be given, but everything else can be in public. So, Pharmacist Odunayi, over to you.
Thank you so much. Good evening, everyone. I apologize that I was late. I had serious technical problems. It's nice to be here. What would you, since I'm not aware of where we are, do you have specific questions for me? Or would you like
if you just kind of give an overview, 3 minutes about the process for the Social Determinants of Health Initiative, that would be fine. I think we did a little bit of background, briefly mentioned what the process is. So whatever you can describe as the chair of the Social Determinants of Health Initiative would be great.
That's fantastic. Thank you so much. I have slides, but I realize we don't have a lot of time now. The process was very thorough and fair. We had several applications, well over 420 as of last night. Data was de-identified, cleaned very carefully. We made sure that every single person was actually reviewed. We then ensured that we checked for the actual, whether there were duplicates, we removed those, and so that we would be fair to everybody. And at the end of the day, we came up with a full set of data of about 400 people as at yesterday that were looked through completely, having taken away all the duplicates. That's how that was done up till now. But there were several stages. For example, we had to remove people that hadn't yet been identified, put them in quarantine, and we went through the process of actually contacting them. Members of our team called and made sure that they could get data information. We are still expecting some more from people who hadn't provided their information. The other thing we did was we verified with the hospitals, the consultants, the clinicians were extremely helpful. We want to say thank you to everyone because that really enabled us to get more people over the line. At the end of the day, a typical fully verified person is someone who has their ID, a form of identification. It doesn't have to be a passport. It can be someone recommending and identifying them, such as their clinician or a leader in their community, and then having a doctor confirm their diagnosis. The fact that they are in active treatment as well matters. Having looked at that, where people had other needs, for example, requesting for medication, we still chose to look into their needs because if you need medication, surely you also need the social determinants of health. You need food, you need transportation. So we looked at that and we ensured that we were fair to everyone. Thank you, Prof.
Thank you so much, Pastor Donoye. We just want to thank you for all the work that you have been doing for the last 2 weeks. You have not slept much. You have been looking at spreadsheet. You have been making sure that everything is validated, the T's are crossed and the I's are dotted. It is really a great thing. Thank you for all you do. And everybody, thank you for all we do. Now, we've been throwing the soft questions. Now we're going to get questions from our audience. Don't make it too difficult, please. Do we have any questions up that we can answer? It's now questions time. Please put your questions in the chat. We would love to answer your questions. I think I saw some coming in. So waiting on that. Thank you. Dr. Uche, do you want to read and assign this question to someone? And I think Dr. Uche might be frozen. Okay. This Wi-Fi social determinants of health, we have to work on that.
Yes.
Okay. My name is Esther from Calabar. Please, cancer is a life-threatening illness. How can one notice the disease, especially people from remote areas? I'm going to throw this to Dr. Dr. Malana to answer
Emanuela. Okay, so
thank you. My tongue is getting tied up.
No, so maybe you can just call me Ella. It's usually easier.
Ella, okay, I love that.
Dr. Ella, yes.
Dr.
Thank
Ella.
you. So, Esther, yes, it is, life-threatening. We advocate for screening so that we can get the diagnosis early. So you need to find, if you say for people, especially the ones in the remote areas, they need to start off with probably the primary healthcare facility closest to them to say, is there any screening service available? If there's any, what age or what is the requirement for me to participate in this screening? And when we screen, we have to have treatments available. So you would now be referred to a proper center, where you can receive treatment. But one thing that is, really, really important is for us to create awareness so that people know that this screening is available for this particular age group, or this screening is available for this gender. There's, prostate cancer screening for the men. There's also mammograms or pap smears available for women to do. This would help us to really start diagnosing people early. And with early, diagnosis comes the cure. So that's the best way we can start off from there. At least there will be a referral process from the primary healthcare facility once you are able to get yourself to that.
Thank you so much for that, Dr. Ella. Now I'm going to go to Dr. Dogo because we know our men don't want to do much. So Dr. Dogo, can you please speak to the men on, how important it is for prevention and early detection, especially for something like cancer. So, I think just look in the camera and speak to Nigerian men right now.
Yes, thank you, Ma. I think what is important in the prevention of cancer is early screening. And then screening means you screen early so that if the cancer is there, it's detected early and it will be curable. But usually, most of these cancers are screen detected. Some, once they begin to give symptoms, they are already advanced. For instance, prostate cancer is screen detected, and it's advocated that you start screening at 50. If you have a family history of prostate cancer, you start screening early. Some say 45 at 45 years, some say even at 40 years. So I think one barrier that we should overcome is getting places where people can easily go and screen. Because sometimes people will enter the hospital, as I earlier mentioned, and they don't know where to go and do the screening. They will be asking, where can I get my prostate screened? They'll say, okay, go to urology clinic. And the process of seeing a urology clinician takes time. And then sometimes when they go to the GOPD, they may be even be misled. So another issue that we need to look at is even educating the health workers at the primary care level so that they can pick those diseases early and do an appropriate referral. Thank you.
Thank you so much. Can we have the next question, which is going to be asked by Dr. Uche? And while we're waiting for the next question, I see a lot of questions that has to do with prevention, screening, treatment, and all those. I just want to tell you that just join right here on YouTube, Thursday Lives. We are going to have programs that we are specifically bringing our clinicians to talk about prevention, to talk about diagnosis, to talk about treatment, to talk about all those things, and we're going to be announcing it. So you are in the right place. Dr. Uche, actually, the question is for you. I'm
yes,
psychic.
thank
I
you.
need to move it for you.
Yeah, thank you so much. I don't know if you can hear me. So the question is, how can get cancer care down to the general hospitals? And the question is, I mean, the answer is that the TWG is on the right path towards achieving that. So if you look at the plan is to integrate cancer care services at all the levels of care, primary, secondary, and the tertiary levels of care. So, but you know, the general hospitals are under the purview of the state governments exclusively. So, federal government doesn't have a general hospital. Okay, so and the primary health centers are under the purview of the local government. So, what we're trying to do is come November 2026 this year, we are taking the national control plan to the National Council of Health, where the state commissioners for health and the Honorable Minister of Health sit and approve policies and programs for the country's health sector. So once the plan is adopted by the state government, we already have in the plan, if you have a copy, you can go through it, we already have in the plan responsibilities for state government. That means they have responsibilities to ensure that these are done at the general hospitals. So we're hoping that once they uptake it, and then they'll be able to domesticate in their various states and the various general hospitals. So what we're trying to do is to ensure that we promote awareness so people know what to do. And then, of course, the basic screening, which can happen at the private healthcare centers, can be performed. PSA is a blood-based test, screening for just clinical examination for breast, basic screening for cervical cancer and other cancers can be done at the level of the general hospitals. And then, of course, basic thermal ablation and other basic procedures can be performed at that level. So in the states where we have piloted such like Lagos, in Rivers, in Kaduna, and other states, these have been integrated at the level of the general hospital. So we're hoping to ensure that this happens within the time frame of this plan. So that means once we go to NCH in November 2027, we're hoping that there will be massive integration at the levels of general hospitals. Thank you.
Thank you so much. So you want to read the next question? I think Dr.
The question about how how do we know that we are cancer-free? I don't know whether this person is asking as an individual or as a country, because the slogan for this TWG is cancer-free Nigeria in 2030. Okay, so if it's so I will explain it based on as an individual and as a country. So as an individual, if you do your screening, which we encourage, whenever I've spoken about cancer, I tell people, give yourself a birthday gift of going for cancer screening, whether it's breast for a man, a woman, whether it's cervical or any other cancer. Just give yourself a holistic medical check on your birthdays. So when you do your screening and you are given a clean bill of health, then you're cancer free at the moment, and then you can repeat based on the appointment given to you by your clinicians. But as a country, we have a framework, an M&E framework to track the baseline and the levels of achievement of our various pillars in the national plan. Okay, so and the target for the country in 5 years is 50% reduction in our burden. And when we talk about cancer burden, it's not just on incidence. We're also looking at improving survivorship. We're also improving various indices of measurement of our screening program, our treatment capacity, our workforce capabilities, and all of that. So all of this will be measured holistically. I was in a meeting yesterday, and somebody talked about the United States of America having attained 35% reduction in their cancer mortality. And yesterday, someone presented to talk about Singapore has attained 21% reduction in their cancer mortality. So we're hoping that when Prof talked earlier, he talked about a cancer patient dying within 6 to 7 minutes. So if we're able to reverse that trend, then I think we're attaining a cancer-free Nigeria. Thank you so much.
Thank you so much, Dr. Uche. This is from Professor Basti. After screening and the person has cancer, what next? What can you do to help them? Okay, we're going to go to Dr. Ella first, and then Dr. Dogo. Do you want to just briefly, in 30 seconds or less, for each one of you? Thank you.
Okay, thank you for the question. So after screening and you confirm that there's a diagnosis of cancer, the best thing is to refer the person to the center that has treatment for the particular type of cancer that has been diagnosed. That would be the best way to be able to ensure that they get the treatment that they deserve. Now, this may not be in the immediate proximity of the patient, so they can start off with the general hospital there to see what care is available. And if the general hospital cannot provide this, they would find a tertiary institution that can provide, I'm just going to specify, for instance, radiotherapy that is needed. If the patient screens and has cervical cancer, then you would need to refer them to a center where they have radiotherapy facilities for her to receive treatment. Thank you.
Yes, Ma, I think in addition to what she has said, appropriate and timely referral, you should emphasize to the patient that he shouldn't go back home and sit down and wait for a long time before going to the appropriate center. Sometimes money, financial aspect may be a barrier of moving forward. Sometimes you may be forced to offer what is available at your center. For instance, if you are working in the state specialist hospital, you may be forced to go to offer what is available there because the patient may not be able to afford going to the tertiary center for treatment. And then another thing that I found very important is that educating the family members, especially advocacy there. Sometimes you may find out that a lot of, for instance, an elderly man with prostate cancer, you find out he has children that are around 50 or even 60 years old, but they have never screened for prostate cancer. So I found this very important, educating those around the patient that this prostate cancer can run in families. And you need to be screened when you reach the appropriate age of screening. So thank you.
Thank you very much, Dr. Dogo. While we are waiting on the next question, I think we take maybe one or two more questions, but while we are waiting on that, are we able to bring up the registration photo for people to see? And I have a question for Pharmacist Oduni, why that is coming up. Question, how can patients, caregivers, clinicians, oh, I think I have the wrong question for you. Okay, wait. Yes. How can patients, caregivers, clinicians, and community organizations help ensure that individuals with the greatest need are identified and connected to available support? And what, yes, that's to Pharmacist Oduni. And this is the website, this is the QR code for you to register. Go ahead, Pharmacist Oduni, please.
Thank you so much, Prof. So it's very important for clinicians to be very aware of the social needs and the social welfare of patients and to know about this initiative. If they are informed about this, they can very quickly and easily refer them to us. The forms are very simple to complete by a healthcare professional, by anyone who knows the patient well enough to know their diagnosis. They can fill this form and send it to us, and we will be able to take it forward. The other thing they can do is just every single patient that they see, bear in mind that they must always think of not just the medication, but how do they get there to get the treatment? How do they stay there? So accommodation and feeding. And how do we ensure that they can continue to be well? As long as we can think about these key needs, we will always be able to ensure that we provide this service, and we ensure that we tell people about it. It's just about creating awareness, and where they haven't yet applied for this fund, encourage them to, help them to, and send it to us. We'll be very happy to receive it and support them. In fact, the applications done, having actually reviewed all the numbers we've said, well over 400 applications, every single one very carefully, we can say that the applications done by clinicians, physicians, healthcare professionals, pharmacists, social workers, nurses, they are the best, they are the better quality ones. And so it's quite helpful for them to think about it and refer people to us. Where people feel it themselves, they try their best, but sometimes bear in mind that your patients already are unwell. They're having treatment, they have several challenges. They're caregivers themselves. In many cases, they have children, they have families, they have concerns about the future with having cancer, and then having the burden of completing the form can be challenging. So any help that any healthcare professional can provide will make a lot of difference and ensure that people who fill the forms fill it correctly and they can receive the help they need. Thank you so much.
Yeah, I actually have a follow-up question for that, Pharmacist Oduni. That is very well said and very well summarized. From reviewing these hundreds and hundreds of applications, and thank you for doing the hard job on behalf of all of us. But from reviewing all this application, what is one to two things that anybody new who wants to complete this form, and here is the QR code for everybody that wants to complete the form, what should they be aware of to make sure that they check all the boxes to be successful and sail through the application process?
Thank you so much. So there are two fundamental things. You must ensure that you have an ID. Of course, complete every key area of the form, such as your name. Definitely, you've got to put a phone number and an email, because clearly we have to be able to communicate with you. But have an ID, and if it's not, it does not have to be a passport or a driving license. We acknowledge that not everyone has that. We have a tiered approach. Second, but just have something that says you are who you say you are. Secondly, have your healthcare provider verify you, or if you have something yourself, that proves that you've got active cancer, you can supply that as well and upload it. So upload the right documents. Make sure that you are contactable should there be a problem. The problem is also another thing I identified, another little matter that should be said is that we do look at every application. So there were a few cases where there were duplicates where people filled maybe female somewhere and male somewhere else, or a different name. And sometimes that comes up because if you've given a name somewhere and it's the same, everything else is the same, but something else is different, I have to pull that out and do an extra verification. That just simply makes, we will not disqualify you. We just need to verify which is which. And that means you are now lower on the list than you should be. So those things matter very much. Thank you.
Thank you very much. Our panel has been very gracious. I think we are going to take one more question, and then we're going to go around for one thing that they would like to share. Dr. Uche, you want to read the question?
Yes. So how does the patient get disbursement? Is it through sending account number, or which office do they visit in their location? So so the forms we are collecting, we are going to request for the relevant account details that will be needed. Okay, so you don't need to visit any office. If you are close to the venue of the flag off for your geopolitical zone, then it will be good for you to be present. Not that you will not get cash there, but of course you will be identified as one of the beneficiaries, because we need to also show that we're not giving ghosts, we're not giving imaginary human beings. They have to be real people. So that means if a beneficiary and you are in Abuja, for example, you'll be required to be physically present on Wednesday, 17th of June. And we're going to share the location. There was a fire accident in the ministry, so the ministry was very unconducive for that exercise. So we're going to share location before Saturday. So if we're not able to get another place that is convenient, we may go to National Hospital or go to FMC, but we'll share location before Friday. Then we're going to also share the location for, of course, I've said that Northeast is going to be in Maiduguri, the Southeast will be in Enugu, the Southwest will be in Lagos, the South will be in Benin. So if you are close to any of these locations for your geopolitical zone, just be there when we announce the dates. So you don't need to go to the hospital to get money. The money will be sent to the appropriate account that will be requested of you. But everything will be transparent. Because of privacy, we will not put your name out to the media, because we don't have to say that you are the one that got it. So we want to protect your privacy in case you want to keep the file to your cancer patient to yourself. Okay, but we're going to have that record in case anybody comes to accuse us of giving it to our friends and relations. We actually show that it was not friends or relations, it was actually those who are accessing care in various hospitals. So if you're not willing for your name to be given out in case there's such litigation or something, then don't apply, because we will not want to answer questions that we can't defend. Okay, but we will protect your integrity, we will protect your privacy, but your details will be provided in case there's any auditing that may be required. Thank you.
Thank you so much, Dr. Uche. Quick follow-up question, just so that everybody is clear to everyone. Could be answered by Dr. Uche or Pharmacist Oduniyi. When should those who have applied so far expect to be getting email confirmation that they've been selected for the Social Determinants of Health Award?
Sorry, Prof, would you like to? I was going to say, Dr. Uche, do you want to answer, or would you like me to?
Well, I think it took off to me as the chair of the SDOH Initiative. Maybe to help you to answer, we're still undergoing through the verification process. Those who have been verified can get their email confirmation before Wednesday. Okay, so that those who are going to come to Abuja for the flag off can come. So it's important those within the North Central and Abuja will be notified before Wednesday because we expect you to be physically present, if possible, on Wednesday. But for the other regions, we'll get you notified as soon as we are done with the verification process. But we're hoping that this will be concluded within the next 1 week. Thank you.
Thank you.
Thank you so much, Dr. Uche. In 30 seconds, in one sentence, let me say 30 seconds. In one sentence, I want to ask each of our panel before we do the closing remark to just state one thing that they would like the audience to live with. I'm going to start with Mr. Olise. Just one thing that you would like to leave for everybody to know about this initiative.
In one sentence. Just to
not one sentence that you're going to be out of breath. Just one sentence.
It's just to say that the Social Determinant of Health Initiative is a walk towards a future where Nigerians, regardless of social or economic circumstances, has a fair opportunity to prevent cancer, access quality care, and survive.
Thank you. So well said. Dr. Manuela.
Okay, so I think for me, I would say if we want to cure cancer, we have to cure the inequalities. And, every barrier that we're able to lift up, be it social, financial, that we take away from this, is one step towards us achieving, survival for this patient. So please keep hope alive. Thank you.
Thank you so much. Dr. Dogo.
Thank you. I think this is a laudable initiative and it's a game changer. And it's going to go a long way in the assisting and improving the outcome of our cancer patients. This will really touch on their psychology as well as the other aspects of life. It's really commendable.
Thank you so much. We'll let Pharmacist Oduna have the last word.
Thank you so much. So the Social Determinant of Health Initiative will be remembered. It will have its story in the sands of Nigeria as the initiative whose process was fair, transparent, consistent, and defensible, and above all, helped patients to get treatment, stay in treatment, and complete treatment, because transport, food, accommodation challenges will be alleviated as a result of this. Thank you.
Okay, great. Dr. Uche, can you just summarize the key messages and I'll give the closing remarks. Thank you so much, everyone, for staying with us. If you could summarize the key messages and votes of thanks to our panelists, that would be great.
Thank you, Prof. Thank you to all the panelists. We're really grateful. I think the take home is that Nigerians will no longer pass through unnecessary barriers to be able to access cancer care. So, courtesy of the NCCP Technical Working Group under the able leadership shared by our own Professor Florida Bedino, through the SDOH shared by Pharmacist Fumi Duni. So thank you so much, Madam Chess, for this other initiative. The ministry is solidly behind all the initiatives. So the speed at which the minister has given us approval means that they actually fully committed to supporting this TWG to actualize its mandate. So thank you so much. And I want to encourage all Nigerian cancer patients to bear in mind that Nigeria actually has very laudable plans for you. While efforts have been made to improve access to early diagnosis and prompt treatment through massive investment in expanding our healthcare capacity through workforce infrastructure, we're also thinking about how to make it not just available but also accessible. So thank you so much, everyone. We look forward to the ministers launching on the 17th of June, 2026. And that will be a game changer in our cancer care ecosystem. Thank you so much, everyone.
Thank you so much, Dr. Uche. And I know that we have so many questions and the questions are still coming. We promise you that we are going to take your questions. We are going to create a Q&A on our website, which is nccp.ng. If somebody could type that in the comment section, nccp.ng. All the questions that you're asking us, we're going to start an FAQ list so that you can see your questions answered. As we conclude tonight's discussion, it is so great. We hope that this conversation has helped you better understand the NCCP Social Determinants of Health Initiative and why we are addressing the social barriers, which is critical to improving cancer outcomes. We encourage everyone to help identify patients who may benefit from support and to share information about the application process. Most importantly, we want patients and families to know that they are not alone. I also want to state that no matter how much the federal government is donating or the TWG members are donating, we are looking for donation as well. We are not going to share that today because we want to leave you with just this idea of focusing on support for patients. But at another time, or you can look at our website, you can see where you can also be part of the community that gives back. Thank you for joining us another time. Next week, join us at 7 p.m. Nigerian time. Together, we can improve access to care, reduce barriers, and move closer to our vision of a cancer-free Nigeria 2030. Thanks for staying with us. Good night, everyone. Thank you.
Good night. Thank you, everyone.
Good night. Good night.
Thank you.
Yeah. Oh, yeah. Da 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 da. Yeah. Sheesh. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. Watch us how we move like this. Watch us how we move. Oh, yeah. Da 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 da. We gon' move like this, like this, like this. Yeah, we gon' move like this, like this. Oh, yeah. Da 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 da. We gon' move like this, like this, like this.